Hi everyone, welcome to 5 Minute Video Study for the NCE. Today we are covering clinical focus and we are in subtopic AU, which is interpersonal partner violence concerns in counseling. This can also be labeled as intimate partner violence. And you might also see the acronyms IPV. And this is abuse or aggression that occurs in a romantic relationship. Intimate partner can refer to current or former spouses and dating partners. Intimate partner violence can vary in how often it happens and the severity. It can also range from one episode of violence to chronic or severe episodes over multiple years. Intimate partner violence can be physical violence, which is when a partner hurts or tries to hurt a partner by hitting, kicking, or using another type of physical force. It can also include sexual violence, forcing or attempting to force a partner to take part in a sexual act, sexual touching, or non-physical sexual events such as sexting when the partner does not or cannot consent. Stalking is a pattern of repeated unwanted attention and contact by a partner that causes fear or concern for one's own safety or the safety of someone close to the victim. And then psychological aggression, which is verbal and nonverbal communication with the intent to harm a partner mentally or emotionally uh, to control uh, to control them over or control over the partner. So intimate partner violence can have very serious uh, health outcomes as well as economic consequences. Some of the statistics is about 1 in 3 women and about 1 in 4 men have reported experiencing severe physical violence from an intimate partner in their lifetime. So that's certainly a significant amount. 1 in 5 women and 1 in 13 men have experienced contact sexual violence by an intimate partner. And then 14% of women and 5% of men reporting having been stalked by an intimate partner. And these statistics come from the CDC, or the Center for Disease Control. So, intimate partner violence has a lot of cost. It has society cost. 75% of female survivors and 48% of male survivors experience some form of physical injury. Some of it can also even lead to death. So there's physical causes as well as psychological causes. It is estimated that the economic costs associated with medical services and related to intimate partner violence and lost productivity as work, as well as criminal justice, it cost the economy around $3.6 trillion. And then over the lifetime of the victim, you're looking at over $100,000 for women and $23,000 for men. So that certainly has both economic, physical, as well as a psychological cost for intimate partner violence. Some of the things that are important to know about is to, especially for young people, teach safe and healthy relationship skills. So, what is a healthy relationship? What does that look like? What is social emotional learning? What is appropriate and what is not appropriate? Engage influential adults and peers. So, again, with a lot of these violence, you have isolation, and part of combating isolation is engagement. And then, um, looking at disrupting developmental pathways towards partner violence. So that can be enrichment programs, family engagement, parenting skills, treatment for children, youth, and family. Create protective environments. Again, having different schools, organizations, neighborhoods that are safe. All of that is interconnected, as well as family support. So understanding how family can help individuals that are kind of going through some of this violence, and then supporting the survivors, looking at victim services, housing programs, different organizations that help with intimate partner violence as well as domestic abuse. So, those are just some things to keep in mind when considering intimate partner violence as it relates to counseling in the mental health field.